My name is Basky Thilaganathan. I'm a professor here at St. George's Hospital of fetal medicine and obstetrics. That means I look after women, and my specialty is in pregnancies where things don't go as well as we want them to. In the 20 plus years we've been working here, we found, and we know in fact, that the majority of the time that things don't go well in pregnancy is because the placenta isn't working as well as it should do. And that means that the baby doesn't get enough food and therefore can grow slowly, and sometimes doesn't get enough oxygen, and that can cause damage to the baby, and in the worst cases, cause the baby to demise. And one of the key factors in placental damage or in the placenta not working properly is smoking. To understand why smoking causes harm in pregnancy, one can consider the placenta like a radiator. It needs hot water to go through it in order for the room to heat up. In the same way, the placenta needs the mother to send blood to it in order to enable the baby to get food and oxygen. And we know that smoking affects the heart and the lungs. And in a mother who smokes, the ability of the heart to send good blood flow to the placenta is compromised. And it's that causes poor growth in the baby, and sometimes in the worst scenarios, poor oxygen delivery and even the demise of the baby. We can choose not to smoke, whereas there are many other things where women don't have any choice. Yes, they may have a particular illness or disease which they can't control, but smoking is a choice which we know can help the baby. There is no doubt in our minds that if a woman can stop smoking, she can significantly reduce her chances of poor growth in the baby and harm to the baby. And I would always encourage that, because at the end of the day, a baby doesn't want anything other than to be given the best chances. Mothers often ask me if it is too late to stop smoking, and the simple and clear answer is that it's never too late to stop smoking. The sooner you can stop smoking, the better the chances your baby has to recover from some of that placental dysfunction, and actually the better your chances of good health in the long term. So even though we're concentrating here on what can happen in the short term to the placenta and to the baby, we know that someone who smokes for several years can cause harm to both their hearts and their lungs. And we would want to encourage you not only to have a healthy baby, but to have a healthy mother as well.